Hi, my name's Phil. I like talking about politics, and in this video we'll be discussing the second coronavirus Prime Minister's questions that take place in a relatively sparse House of Commons, but with other MPs able to join in via video conferencing. Apologies for the hair if it's a little bit messy, because after PMQs I went out to do the daily exercise with the dogs. We were teaching them how to walk nicely. Didn't go very well. They are pugs. But anyway, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, Boris Johnson, even though he's back officially, he did not attend the Prime Minister's questions himself. I'm not going to say he was dodging them. We know he dodges these things. We know he will attempt to dodge them in the future. But given that the reason stated was the birth of his kid this morning, which is not his first, but is probably the first one he was actually in attendance for, I think we'll give him a pass this week. Were it anyone else, we wouldn't think twice about forgiving them for missing PMQs with the birth of a child. So, we'll just see if he turns up for Starmer next week and wish him well in the meantime. So, Dominic Raab as First Secretary was leading the PMQs again. And he actually at the start, remember last week, or you may not remember, but last week Keir Starmer said he wanted the numbers of NHS workers and social care workers, care home workers basically, that have died. And Raab wasn't able to furnish him with the care home workers. So he did actually come out with the figures today for both of them to preempt that, which is fine. That was good. But he also made an initial comment, which is rather odd, saying that the government measures have not only allowed the NHS to be able to treat COVID patients, but also patients of other ailments. Now, that was a bit of a baffling thing to say when it is quite newsworthy at the moment about the prediction of the number of people who are likely to die of cancer as a result of not being able to get the treatment they normally would be able to get. And also this idea of treating COVID patients when actually thousands of them have been dying at home after being refused treatment in hospital is also a bit rich. But never mind. On to the questions from Keir Starmer. They get, as leader of the opposition, gets 6 questions. Then I'll go on to the SNP's questions after it as well. I'm not going to give you a complete blow-by-blow account of the whole procedure. So Keir Starmer opened up with talk about the caring, the deaths in care homes rather, as we're starting to get some real figures now. The government had sort of done that and closed its eyes about them in the past, not wanting them to be made public. They are starting to come out now. He talks about the deaths in care homes as well as the ONS figures, the Office for National Statistics, from other areas as well, tallying up with the official death figures. And he puts it at a minimum of 27,000 in terms of what the government seemed to be in agreement on. But saying that in itself is an underestimate, and not kidding. The actual figure is believed to be well over 40,000 now. He did note that 6 weeks ago the government had stated that it would consider keeping the deaths below 20,000 to be a success. And he said, as we're way above that and only part way through this, we're not at the end of this, we're part way through it. Starmer says that these figures indicate that this has been far from a success, truly dreadful. In response, Raab talked about this target of 20,000, saying that we know much more about it now, and he was saying to Keir Starmer he shouldn't really be picking on the chief medical officer and things like that, which he did then say when he got up again. And no, I'm not having a pop at them, mate. I'm having a pop at you. Didn't say it in those words. But he did also say that he disagrees about making international comparisons, saying it was too early for this, but that it wasn't even really part of Starmer's question. So basically, we got a bit of a non-answer there. And as I say, Starmer did suggest in his next question about heightened anxiety for frontline staff. He was asking what, in Raab's opinion, was the reason, for example, that the virus was spreading so quickly in care homes. Now, what Raab said in response to that was that, well, the big challenge in care homes, of course, he didn't deny that it was spreading now. That's important in a moment. He said there's this ebb and flow of people in care homes over which the government don't really have control in the same way that they would in a hospital. People come and visiting, things like that.
Although I did think that was odd, bearing in mind that a lot of care homes were preventing visits where they didn't have the facilities to maintain social distancing. And unfortunately, this did mean on occasions not being able to visit a relative as they were dying. And then the government pretty much suggested that they were going to stop care homes doing that. I don't know whether they did or not, but they did announce that they were going to stop care homes doing that. And it's absolutely important that people should get to visit. So this complaint about, not being able to control who goes into care homes and not, well, they scuppered the care homes that tried to put measures in place. He also said that they're expanding the workforce by 20,000, but he didn't say, because a lot of these questions are about the NHS frontline healthcare, but also social care. He didn't really say which workforce. Was it the NHS? Was it social care? Was it both combined? That wasn't really made clear. But again, you'll notice he's not really answering the question directly, although this did at least go part of it. He was basically saying, well, there's people go to care homes, we can't control that. Really, what I think the point was, well, you're discharging patients from hospitals, elderly patients from hospitals, until recently untested, when we knew there were COVID patients, and sending them back into care homes. Do you think that might have been the reason? Because obviously the weeks of lag in this, although Dominic Raab would now say, well, actually we are now testing those patients. They weren't weeks ago, and we're seeing the result of that now, of course. Question 3, Starmer was pointing out that Raab had said in an interview at the weekend that deaths in care homes were falling, and he said, actually, the figures don't show that. He seemed to be a bit of a fibber there, Mr. Raab. He didn't actually call him a fibber. You're not allowed to do that in Parliament, are you? But then he asked about PPE for frontline, obviously with the big panorama expose in particular. But it's an issue every week. We've known about this. He did point out that it is 10 weeks since the Health Secretary, Matt Hancock, declared that there was, as a result of this virus, an imminent threat to life. And he quoted, I think it was the Royal College of Physicians, but there's any number of doctors groups saying the same, that 1 in 4 doctors are still not getting the right PPE. And he quoted them as saying that the PPE situation is actually getting worse, not better. So it's not just that the government's behind and catching up slowly, that actually the situation is getting worse, not better. And this is from the front line, from doctors. And he was saying, so what's going on and how can it be fixed? In response to that, Raab basically, first of all, talked in terms of care home deaths, the disparity between him saying they're falling and the figures saying they're rising. There's a margin for error here. Whatever. Now, he did deny that things are getting worse. He said, I'm going to take exception to you, things are getting worse. Now, again, just to segue in with what Raab then said in a minute, he then said, he did make the point, Keir Starmer, did make the point, you're not disagreeing with me, because it's not me that's saying this, it's doctors. This is the Royal College of Physicians that I was quoting, and Starmer did make the point that what he was talking about was information from the people who would know about these things. Raab is denying that things are getting worse, even though doctors and doctors groups say otherwise. And his main defence, effectively, for the death toll was, well, it could have been higher if we didn't do this, this and this. It could have been way higher, to which, I would have said, well, it could have been way lower as well. The government's response seems to be thankful we didn't kill even more of you. He talked up the orders of PPE, the usual thing that they've been doing, which is, we've been ordering this, and this. Banged on about the global shortage drum. Now, there are a couple of criticisms I am going to put in for Keir Starmer, not heavy ones, or should we say a couple of things I would have said. To that point, when he got up again, I would have made the point that it doesn't matter how much PPE you're getting in. What matters is how much you're ordering, and you haven't been ordering enough. That is the key point. And when they have ordered PPE, it has been arriving. This thing about global shortage is nonsense, because when they're ordering kit, we're getting it, and it's not taking that long. The point is that we didn't order it when we should have done. We only started ordering very late on. But anyway, what Keir Starmer was talking about was that, and his next question was about testing now. He said, so last week what happened is Dominic Raab kept banging on about capacity. Oh, we've got the capacity to test 40,000 a day. But Keir Starmer said, but you only tested 18,000 a day. And actually, on the day of Prime Minister's questions last week, it was actually only 13,000. So it had actually gone down. So now they were quoting figures that the capacity was up to 73,000 a day, and that on Monday, 43 actual tests took place. But only 29,000 people, actual people, were tested. So there must have been a couple of repeats. Now, Starmer was saying that last week, Raab was trying to point out that the capacity was there, but there wasn't the demand. Starmer was pointing out the demand is there, and it's provably there because now that they've expanded how many people are eligible to get tests, the demand has been breaking systems. Websites have been failing. The systems that are used to refer people are just breaking under the strain. The demand is absolutely there. So he was saying, so how come on Monday, with a capacity of 73,000, we only actually carried out 43,000 tests? What about the other 30,000 tests that were supposedly available that weren't used when we know now the demand is there? And he also said about the 100,000 tests a day. Obviously, that's not happening. We're the day before that target was supposed to be met. It's not going to be met. We're not even going to have the capacity for 100,000, but we're certainly not going to be testing 100,000 people tomorrow. But then Starmer said, actually, the date doesn't really matter. What matters is we're moving towards it. But that the government said from the 100,000, we're going to be moving to a 250,000 target. He says, is that still the aim? And roughly when can we expect it? Raab, of course, announced that, anyone who now needs a test can now get one. It's not just frontline NHS staff or care home staff. Anyone who needs one to be able to go to work will be able to get one. That's not actually, I've got a little bit of anecdotal evidence here. This is not someone I know directly, but it's someone who is known by someone known. And this is reliable from my point of view. Someone who was referred to a test. They are ill. They've got symptoms of COVID. And they were told to go to a testing station to get themselves tested. And they did. And they drove there. This is probably inadvisable. And when they got there, they weren't tested. They were just told, no, you don't need a test. Despite the fact that they had been referred, they didn't just take themselves along, they had been referred, and they were displaying symptoms, some of the symptoms of COVID, and they were not tested. So I'm wondering how many people are actually going along to these testing stations and are not being tested. Again, we're pointing out on Monday, 73,000 capacity, 30,000 tests not used when we had the capacity for them. How many more people are going and not getting the actual test? But the key thing for me is Dominic Raab was not explaining how they're going to get to that, making the capacity equal to the actual number of tests carried out, or indeed if they're actually really going to get to that 250,000 a day anytime soon. He certainly didn't give an estimate on when that would be. There we go. Fifth question, Starmer said he was happy because Raab tried to go a little bit on the aggressive and say, oh, you're not really giving us, credit for the social distancing and the testing measures we've been improving on. To which Starmer said, yeah, that's fine, that's great, grand. But then there's all the other stuff. Exit strategy was his next one now. He said the people need to know what is the exit strategy. He said, I'm not asking for a time frame and I'm not asking you to lift the lockdown. He said, I'm quite clear about that. I'm supporting the lockdown. And I'm not suggesting that you should even have an estimate for when we come out of it. That's fine. That's based on the evidence. What we need to know is what is the strategy. And he said we need communication for what comes next. The people need to know in order to be able to trust the government to comply with measures when they are announced. And he also said, for Labour to support the government, they need to know what the government's position is. So the government needs to announce it as well. He noted that on Monday, the Prime Minister Boris Johnson said that he wanted full transparency. So Keir Starmer said, so can we have some, please? No, was the response from Raab. And what he was saying at this point is he said SAGE, which is our scientific advisory panel, he says we're relying on SAGE to tell us what those are, and they haven't reported back yet. So until they advise us, we can't come up with one. So basically, he is at this point admitting that there is no exit strategy, when weeks ago they said that they had one, they just weren't going to tell us. Now they're basically admitting they haven't got one. He said that Labour is, of course, free to propose anything that they like in relation to schools and things like that, but the government want to wait for the advice from SAGE before deciding. Fine. In question 6,
Keir Starmer did note that the problem with this strategy is we're falling behind. Again, pointing out with other countries, saying there are countries in Europe, he reeled off a few, that have an exit strategy. And he also noted that Scotland and Wales within the UK have an exit strategy. And he says, how are we going to have a four-nation approach? Two other nations have already come up with a strategy and we haven't on behalf of the whole UK. And that was his last question, unfortunately. So this is always where the Prime Minister or whoever's deputising the Prime Minister has the advantage, because they always get the final say. So Raab again tried to suggest that Starmer was arguing against experts in SAGE again, which absolutely is not. And my second criticism, if I'm going to have a criticism for Starmer here, is because Raab referred to SAGE several times, I would have pointed out, you keep referring to this group as if it's a scientific group, and SAGE normally is a scientific group. However, given that we now know that Dominic Cummings is there and taking part, and because we're not getting to see the minutes of meetings, and because we're not allowed to see the evidence upon which they are making their decisions, it actually sounds like a political group that just happened to have scientists on it. I'd have made that point. Maybe there was some good reason for Starmer not making it. I don't know. Call that a criticism or just call that something that I would have said. I don't know. But Raab did try to suggest that actually you'll find Scotland hasn't published an exit strategy. At which point a look came over Starmer's face as if to say, you what, mate? Because I'm going to say, I'll link it below so you can have a look yourself. Nicola Sturgeon did, on behalf of the Scottish Government, publish something that I would call an exit strategy. Raab denied that that's what it was. He said, yeah, they've published this thing. It's not really what I'd call an exit strategy. Now, because Starmer's not allowed any more questions, he wouldn't have been able to ask, because I would have said at that point, if you could, I wouldn't have been able to, because it was the sixth question, that, okay, if that's not an exit strategy, okay, if that's not what but can you, the government, publish something that's like that then? Whatever you're calling it, can you publish something of that level of detail? Because that's all we really want. Because I'm going to say it looks like an exit strategy to me. So those were the questions for the Leader of the Opposition. Actually, the next question was not even from the SNP, Ian Blackford. It was actually from a Tory MP. I gave up the will to live at this point. I had to watch the rest of it later. And he basically, after all the serious questions about testing and PPE and exit strategies and deaths and all the rest of it, a Tory MP stood up and said, can we open garden centres, please? All right, okay, fine. But, the SNP, I'm not going to go through all the questions that were asked, but the SNP are the second largest party in opposition. They get 2 questions. And Ian Blackford, unfortunately, the questions he asked, they were absolutely right to ask the questions, absolutely topical. He knew he wasn't going to get a decent answer, but fair enough. So the questions he was asking about, there was Brexit, why are we not extending the transition period? And, Raab, as you would predicted, saying, our position, we're not going to extend. And actually, we need to go on this path so that we can remove uncertainty for businesses. The problem is, of course, that it's the current situation that means there is uncertainty. Like, if we extended the transition period, businesses know with absolute certainty what are the rules for trading next year and the year after. The current situation is they have no idea. No idea at all. And this was the point that Ian Blackford tried to make with his second and only other question that he gets to ask, trying to point that out as well, and also point out all these economic groups, the IMF, the OBR, all warning of the massive economic crisis that the world is already suffering without Brexit on top of it as well. But like I say, there isn't really anything to discuss there. As much as Blackford was absolutely right to make these points, it is absolutely crucial. You're not going to do anything other than shine a spotlight on the government's messy, as he puts, gamble with our economy. But for that reason alone, it's worth asking anyway, because the government then has to go on record as announcing its stated lunacy. But those were the highlights from PMQs today. Let me know your thoughts in the comments below. I hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.